So I'm going to start with the first question from earlier in the week that was submitted prior to the webinar, and this really is a question for Lisa about what's on all our minds, and that is updates. What's the update on treatment for COVID-19, and are we going to see new treatments coming anytime soon?
So around the question of treatments, new treatments, as you mentioned, there's no treatment that's approved right now in Canada or anywhere else for the treatment of the lung disease or any other organ disease associated with COVID-19 at the moment. And so that's not to say there isn't therapy. Therapies include supporting breathing if people end up with difficulty breathing, fluids, and medications that will help to regulate blood pressure if they become severely ill. So I don't want people to forget that there are some therapies that can help people to make it through this and to bridge people through the worst parts of disease. And I think that's important to remember when we look back at times like the 1918 epidemics. None of those supportive efforts were there and available. So just a little pause for a moment that when we say there are no treatments, that does not mean there are no therapies. But specific COVID-19 related treatments that we know work specifically against either the virus or the immune system to help with this actual acute disease, well, there aren't any at the moment, but there are many that are being tried. Some of the more popular include some direct acting antivirals that aren't developed specifically against this particular virus, but have been used with other viruses, including Ebola or HIV, or other investigational agents against other RNA viruses. Those are all in various stages of clinical trials around the world. Probably one of the more popular ones and one of the ones that has most enrollment is lopinavir-ritonavir, which is an HIV medication used to inhibit the protease part of viruses. It has some activity against COVID-19 and may have some results that look promising. There's another investigational medication that isn't available outside of clinical trials in Canada called remdesivir, again, a direct-acting antiviral agent that's being developed, which seems to have good potency against the enzyme, the RNA polymerase part of the virus that makes copies of the virus. So particularly, this is being looked at in the cases of moderate and severe disease. The other agents that are being assessed fall into the broad category that many people on this call will be familiar with, including the immune modulation agents. And so we know that much of the damage done in the lungs during COVID-19 related disease is associated with fibrosis and inflammation in the lungs that happens fairly quickly, but after the first part of disease. And medications that have been attempted, I mean, there have been many around the world, but the biggest trials at the moment that are ongoing include inhibitors of interleukin-6 receptor, so to ramp down the immune system through interleukin-6 inhibition, as well as other medications like JAK kinases, which you will also maybe be familiar with as well, including ones like baricitinib. So there are many others that are in those classes that are being assessed, but the biggest trials are around those types of molecules to try and ramp down the immune system. And some combinations of those medications as well have been suggested. So those are the ones that are newest. There are trials going on that are based in both the US, Europe, and Canada, as well as China. And there are a couple of sites that are enrolling some of these trials around the country. And those would be sponsored by the drug companies, but there are also what we call investigator-initiated studies that are looking at these agents either alone or in combination for moderate and severe disease. And some people are starting to dip their toe in things like Plaquenil, a medication that's already on the market, that's available and has a long well-known side effect profile, but fairly safe, that may be used as well in earlier disease before people have severe symptoms. So that's a long-winded answer to say lots going on, but if you're not in a trial that doesn't use one of these medications, I wouldn't feel too badly. We don't actually know if they work yet, and that's why the trials are being done. So while there is some promise, including, I didn't mention the convalescent serum trial, but if anyone would like to talk about that, we can talk about it after as well. we don't know if they work. So when people come to me in a panic and say, but I must be in the trial, otherwise I'm not getting treatment, I do remind them they do get treatment. There's therapies that are available. They're just not specific. And we don't necessarily know that these work yet.